Hello, my name is Dr. Urska Dobersek, and I'm a psychology professor at the University of Southern Indiana. And I want to thank you for the opportunity to share our work. So over the past couple of years, my colleagues and I published a systematic review and followed up with a meta-analysis examining a relation between eating meat and mental health with a focus on two of the most prevalent disorders, depression and anxiety. So in the past century, dietary restrictions are becoming more and more prevalent and popular worldwide. People are omitting foods for many reasons. They choose vegetarian lifestyle for ethical reasons, such as animal rights reasons, and to improve their mental health. So in addition to increased food restrictions over the past 2 decades, there has also been a substantial increase in mental disorders. In 2017, the World Health Organization reported that mental illness was the leading cause of disability worldwide. They estimated that over 300 million people suffer from depression, and over 260 million people suffer from anxiety. So people have been altering their dietary patterns to prevent or even treat their physical and mental diseases. But the question is that a good idea? Is omitting foods healthy? Well, the evidence on whether abstaining from meat is healthy has been contradictory. Some studies suggest that vegetarians have better mental health. They reported fewer negative emotions, lower anxiety levels, and better mood comparing to meat eaters. However, there has also been an increasing evidence that individuals who abstain from animal foods may suffer over time from nutritional deficiencies and reported poorer physical and mental health. They're more likely to suffer from major depression and anxiety, and also are more likely to commit suicide comparing to meat eaters. So an important point here is to mention that this evidence is based on self-reported diet and mental health. So given this contradictory research, there is a need for clarity. As such, the purpose of our reviews was to identify the reasons for this conflicting evidence and to determine qualitative and quantitative relation between the meat and mental health with a specific focus on depression and anxiety. So we searched 5 online databases for primary studies that examine psychological health in meat eaters and meat abstainers. And studies were included if they focused on well-defined psychological constructs such as depression, anxiety, stress, self-harm, and well-being. If they were written in the English language, and there had to be a clear distinction between meat eaters and meat avoidance. We excluded the non-English language studies and studies that examine meat consumption on some kind of continuous level, such as, for example, they may ask participants, how often do you eat meat, or to what extent do you eat meat, or some sort of multi-level variable. So following the PRISMA guidelines, we found over 7,000 relevant articles, and 20 of them met our inclusion criteria. So afterwards, we extracted relevant data from these 20 articles on study design, participant characteristics, and information on psychological outcomes and dietary assessment, and of course, the main findings. So an important aspect of our reviews was study quality or methodological rigor assessment. And we developed a scale for the purpose of our reviews to assess the quality of each study on study design, sampling, recruitment strategies, assessment, and interpretation and communication of the results. So studies range from high quality to low quality, or high to very low confidence in results. So in our qualitative analysis of primary outcomes, that was depression and anxiety, 9 studies, a little bit over 140,000 participants favored meat eaters. That means that individuals who were consuming meat had lower levels of anxiety and depression. And 2 studies, close to 760 individuals favored vegans and vegetarians, meaning that vegans and vegetarians had lower levels of anxiety and depression. Our results for the secondary outcomes, that was self-harm, stress perception, mood, quality of life, and affective well-being, were less clear. So 4 studies, a little bit over 360,000 individuals favored meat eaters, and 3 studies, close to 800 individuals favored vegans and vegetarians. So we performed a meta-analysis on only primary outcomes, that is depression and anxiety. And this analysis confirmed our qualitative findings. And here we see a forest plot that depicts a relation between diet and depression. So studies here are arranged from high quality Formicolac to low or very low quality Beeshold. And on the right-hand side, we see every study has its associated square, and these squares represent a strength of the relation between diet and depression. And each study also has its associated 95% confidence intervals, which are seen by these lines going through every single square. So we see that the higher the quality study, the stronger and more consistent the inverse relation between meat consumption and depression, meaning that eating meat is associated with lower levels of depression. So when we take into account all these 20 studies, the overall effect over here is represented by the diamond. And the higher and more positive the number, the more positive the finding favoring eating meat. In other words, meat eaters have lower levels of depression comparing to vegetarians. The same patterns were observed for anxiety. Again, studies here are arranged from high quality to low quality, and we see the stronger and more consistent inverse relation between meat consumption and anxiety. Again, meaning that eating meat is associated with lower levels of depression. So as mentioned before, an important part of our reviews was study quality or study rigor. So to see the impact of the study rigor, we performed a cumulative analysis. And again, as before, studies are arranged from high quality to low quality. And we tested the impact of each study on the overall relation where the studies were sequentially, that is one by one, added into the model. And again, here we see the high and moderate quality studies show greater differences, whereas low and very low quality study show smaller differences between eating meat and vegetarians. And again, the same pattern was observed for anxiety. So in sum, there is a clear evidence that being vegetarian is associated with higher rates of depression, anxiety, and self-harm. And the results with respect to other secondary outcomes, such as mood, quality of life, affective well-being, were less clear. In our quantitative analysis also showed that not only vegetarians, but veganism is associated with higher depression comparing to meat consumption. However, there were no differences between males and females on any of these relations. And finally, we showed that the higher the study quality, the more positive the benefits of eating meat. So in terms of the strengths and limitations of the reviewed literature, the most rigorous studies used objective assessments for their mental health, or they used multiple measures, such as physician-diagnosed conditions, prescription medications, and self-reported symptoms and behaviors. The most rigorous studies also had large representative matched samples, whereas the least rigorous studies had biased recruitment strategies and biased convenience sampling. One of the major limitations of all studies included in our reviews was the use of self-reported questionnaires, which is not a good way to measure any variable because of the potential for misreporting, social desirability, reactivity, and of course, false memories. Many studies did not include important information on variables such as race, ethnicity, religion, as well as lifestyle behaviors such as smoking and alcohol use, which directly affect health and physiologic determinants of dietary intake. And finally, most studies were correlational. As such, we cannot make any temporal nor causal inferences. So our reviews had several strengths, which is first, our decision to select only studies that provided a clear distinction between meat abstainers and meat eaters, which was necessary because self-reported assessment, such as food frequency questionnaires, should not be used for a quantitative analysis because of their invalidity. Our psychological outcomes were limited to only well-defined constructs and also to the most prevalent disorders, anxiety and depression, which allowed for focused yet rigorous analysis. And finally, with over 170,000 participants from many geographical regions, so having a large sample size provides more generalizable and definitive conclusion. There were, of course, also some limitations, such as exclusion of the non-English language studies. And we also excluded many other studies on this topic because of our clear distinction between meat abstainers and meat avoidance, meat consumption, and also focusing on only well-defined psychological constructs. So based on our findings, we have a few recommendations. So researchers should use more objective assessments and physician-diagnosed disorders over self-reported symptoms. And the use of probability sampling compared to convenience is preferable because of the individuals who are highly invested in specific dietary patterns may be predisposed to intentional and non-intentional misreporting. And detailed health-related histories, current lifestyles, as well as complete statistical information should be reported to allow researchers to explore potentially important and unanswered questions. And finally, instead of correlational and observational studies, researchers should use more rigorous study designs such as RCTs or randomized controlled trials. So to sum up, our findings do not support veganism and vegetarianism as a strategy to benefit psychological health. For more information, please visit our papers in the critical reviews in food science and nutrition.